There was a time that I would have jumped up here like Walt Ellsdale did. I also chose one of these resistance when Mr. Clark called me quite a while ago and asked me to introduce our esteemed Universal Health Foundation. And when Mr. Clark called, what do we all do? We show up. And for those who don't, I'm not sure what happened. Mr. Clark had to work today. Those should know that I'm the current president of Greater Haven, Gnhbpa, but I'm probably wearing my hat. My larger hat is the health chair for the Unversal at the state level. And today we have our annual conference, and I presented our report on healthcare access for African Americans in the state. And similar to what we read from Regina, Universal Health Foundation under one Figueroa, our lives have become intertwined as of late. We should all know that all the health plans, well, all the presidential candidates, none of them looks at healthcare relative to African American issues. None of them looks at health disparities. It's all vanilla olive, and we all know that that is never good for minorities in this country. But Universal Health Foundation has seen and met with me and the NAACP to forge a partnership around our needs, so that we're not left out of this new Universal Health Plan. However, if it comes out, what the formulation is. If we don't work with Universal Health Foundation or any other foundation relative to our unique needs, issues of mortality, so devastating to our community. I just did a report on diabetes in Gnhbpa, where 8 to 1 amputations African Americans, 10 to 1 end-stage renal disease, and goes on and goes on and goes on. We have to be included. And Mr. Figueroa and the Universal Health Foundation have said they will include this in their plan. That's why I'm so proud to be able to introduce Universal Health Foundation. My note was that we're not talking about Mr. Juan Figueroa today, we're talking about Universal Health Foundation, but we all know behind every organization there is leadership. And that's what Mr. Figueroa is bringing to Universal Health Foundation. Mr. Figueroa, please come forward for the 2007 Outstanding Organization for Change. Black field is in, I think it's the font is number 4. Gina is much younger than me. It says, Greater Haven Business and Professional Association presents the most outstanding organization for change awarded to the Universal Health Foundation of Connecticut, October 26, 2007. Thank you.
Thank you, Jim. Good evening to everyone. Buenas noches, that's right. I want to first congratulate the honorees, my fellow honorees. And without taking anything away from anyone, I do want to point out that the small business owners are very special to this state, to this city, to this community, because they are providing and are the backbone for the jobs that are being created in the congratulations for your work. And let me also just thank Cornell Wright as the president. And I too want to point out to Mr. Gerald Clark for a sec, because sir, your energy, sir, your commitment, sir, you make an outstanding ambassador for this community to the healthcare community. While I have the privilege of the podium, let me say that universal healthcare is about many things. Yes, it is about the uninsured, but it is about the underinsured. It is about working families. It is about small businesses. It is about a fundamental human right and not a privilege as far as the foundation is concerned. But as Jim just said, it is also about dealing with healthcare disparities based on race and national origin. And I'll tell you, as a former civil rights lawyer with the Puerto Rican Legal Defense Fund for 10 years, I think you will agree with me that quality, affordable health care and the elimination of health care disparities is the civil rights issue of the 21st century, which we must do. I appreciate very much on behalf of the staff, Kate Bush, who you all work with, and is the person in my office that works with the small business network for universal health care, and on behalf of the rest of the staff, on behalf of the board, and let me say this, since Jim, I appreciate the words and the fact that he mentioned the NAACP study. Let me just end by saying, okay, so let's make, well, let me just backtrack for a second. Their report recommended that there be created in the state of Connecticut Office of Minority Health. So let's just end by agreeing that for the 2008 legislative session, they're going to get an office, make sure they're going to get an office of minority health in this state. And for 2009, we're going to get a universal health care guaranteed access bill in the state of Connecticut. Thank you very much.